Good evening. My name is Ruel Dixon, and I have the honor of serving as the bossless of the Epsilon Iota Iota chapter of Omega Psi Phi Fraternity Incorporated. On behalf of our chapter, I extend my deepest gratitude for your presence at this iteration of our Omega Uplift series, Myths, Facts, and Lives Saved, a Transplant Conversation. While organ donation is often called the gift of life, it is also a topic shaped by history, healthcare disparities, and experiences that have led to understandable mistrust. At the same time, the need is critical, as Black Americans are disproportionately represented among those waiting for life-saving transplants. There are also many myths and misconceptions surrounding organ donation, from concerns about fairness and misunderstandings about the process that continue to influence decisions. Tonight, we aim to bring clarity and share truth and elevate real voices, creating a space for education, dialogue, and empowerment. I would like to take a moment to recognize our Social Action Committee and our dedicated chair, Brother Gigi Martindale, for their unwavering commitment in organizing this impactful program. Their work ensures that our community remains informed, engaged, and inspired. Additionally, I extend my gratitude to our immediate past bossless, Brother Alexander Jones, whose vision in 2020 led to development of the Uplift series, initially as a platform to educate our community on the nuances of COVID-19 and vaccine awareness. Since then, this series has evolved to address critical topics that are essential to our community's growth and well-being. For 114 years, since its founding on the campus of Howard University, Omega Psi Phi Fraternity Incorporated has been guided by its four cardinal principles: manhood, scholarship, perseverance, and uplift. Omega has played and continues to play a vital role in the social and economic progress of our nation, particularly in enhancing the lives of African Americans. Through our 12 nationally mandated programs, Epsilon Iota Iota has been steadfast contributor to the greater New Haven community for 35 years. Before we begin, I'd like to share a few reminders. All participants will be muted during the presentation. We encourage your active engagement. Please use the chat feature to share your thoughts and questions. Questions will be addressed at the appropriate time. And before we begin, I would like to recognize our current district representative, Brother Raymond Bailey. Brother Bailey, you have the floor.
Thank you, Brother Dixon. And I want to thank you, Brother Martindale, and all the brothers of Epsilon Iota Iota who started this program. This has been so impactful. I talk about what you all do and the outreach you have here. What you are doing tonight is near and dear to my heart and close to home. This is something that is needed. As usual, you've hit another home run, and let's begin the conversation.
Brother Kevin Walton is our series moderator. Brother Kevin Walton.
Good evening, everyone, and good evening, Brother DR. On behalf of the Epsilon Iota Iota chapter of Omega Psi Phi Fraternity Incorporated, we welcome you to our Uplift series community conversation. We thank each and every one of you for taking time to join us for what we believe is one of the most important conversations we can have as a community. Tonight's topic, organ donation and transplantation, is not abstract. It's deeply personal. It is about real people, real families, and real lives hanging in the balance. It is about decisions often made in moments of unimaginable pain and gifts that offer immeasurable hope. This evening, you will hear from voices at different points of the journey. Someone who received the gift of life, someone still waiting for that gift, parents who have made courageous decisions to donate their child's organs, medical professionals who navigate this process every day, and community advocates working to turn awareness into action. Our goal tonight is not to pressure, but to educate, humanize, and empower. We want to leave you informed, inspired, and prepared to have conversations that could one day save lives. We ask that you listen with openness, respect, and compassion. Lives depend on it. So let's begin. So we're going to start the program with Mr. Mark Brevard, who's going to start us off. Mark, the floor is yours.
Great. First of all, I'd like to thank the brothers of Omega Psi Phi Fraternity Incorporated for organizing such a meaningful conversation on this evening. My name is Mark Brevard, and I am the Senior Director of Multicultural Outreach for New England Donor Services. New England Donor Services is a not-for-profit organ procurement organization, and we coordinate organ and tissue donation all across the New England region. It's great that we're having this conversation this month because April is Donate Life Month, and it's a time set aside all across the country to bring awareness, inspire hope, and call out communities to action. Across the United States, more than 100,000 men, women, and children are waiting for a life-saving organ. Here in New England, there are over 5,000 persons, and in Connecticut alone, over 1,000 neighbors who are waiting for the gift of life. Every one of those numbers represents a story, a mother, a father, a child, a friend hoping for another chance of life. That is why Donate Life Month matters. It reminds us that one decision, that one yes, can save up to 8 lives and heal dozens more. Next slide, please. So a lot of people ask what happens when I register to become a donor, and they ask what can be donated. So as you can see on this chart, you could save over 80 lives. And you say, well, how is that possible? So 8 lives can be saved with organs. And then as a tissue donor, you can save 75 or more. The organs that are available for
Mark, I think you accidentally muted yourself.
Brother Bosses, can you unmute him?
Thank you. I apologize for that. I apologize. Thank you. So again, let me start from the beginning. These are the organs that can be transplanted, and you can save over 80 lives. 8 of these organs are the kidneys, the liver, the heart, lungs, pancreas, and intestines. And then tissue donation consists of cornea, skin, bone, heart valves, and blood vessels. As you can see, most needs are for persons who are waiting for kidneys. Again, tissue donation is something that is used for breast reconstruction, also for dental work, different things also with the tissues that can be used. There are 2 organs that can be given to a person if they are alive, and those are the liver, which you can transplant, and also a kidney, because the liver will regrow and you can function with 1 kidney. This evening, we're going to hear from persons who are waiting for kidneys, persons who have had transplants, and also donor families who have made the decision, the gift of life. So next, we will have Carolyn Fletcher, who will give her testimonial as a donor mom.
Good evening, everyone. My name is Carolyn Fletcher. I am a senior administrative assistant at Walton Haven Hospital at HCL University in the Division of Plastic Surgery. And my son was 16 years old at Notre Dame High School in West Haven. Honor student, 3-sport athlete. In my world, he was going to be someone famous one day. And he came to me at the end of the school year and asked if he could participate in a supervised pizza party at one of the students' homes. Now, I'm the helicopter mom. I never used to let him ride with anybody. I took him wherever he needed to go, dropped him off, picked him up. But I decided I'd let the reins go a little bit and let him go. It's the end of the year. He did fabulous during the school year. Let's let him go. 11 o'clock curfew, be home, and all is good with the world. Well, at 11 o'clock, I received that call that no parent ever wants to get, that your son's been in an automobile accident. You need to get to the hospital. No details, just get here. And when I got there, the whole atmosphere was a little weird to me. I see chaplains, and the nurse said to me, "Are you alone?" I said, "Yes." And they were like, "You need to call your family. your son has a traumatic brain injury and he's in a coma. Well, my world was all shaken up, upside down, know what to do, where to go, how to deal with this. So everything just started going in fast motion. We're getting him to ICU, trying to figure out how we can save this kid. His head was swollen so big, and I'm praying to God, like, you can't take my only child. This can't be happening to me right now. And during this process, this person came to me and said, how would you feel about organ donation? And this mother bear flipped out on that person and said, you need to go find somebody to take care of my kid and not worry about organ donation at this point. Now, I learned a lot about this process going through this whole thing. A lot of it has made much sense to me afterwards, but when you're going through it in the midst of a tragedy, you don't understand. So now I'm trying to figure out what we're going to do. I walk into the room, he's responding to my voice. They want to keep him calm because they don't want the brain to swell anymore. They put him in a medically induced coma. I'm watching his brain activity go up and down, up and down, up and down, mostly down. And, now this is on a Friday night. By the end of Saturday night, they came to me and said there's nothing else we could do. I was facing the reality by watching that brain activity over the course of 12 hours or more. And I'm going like, he's not going to make it. But I'm praying that, because I know somebody that's bigger than all of us that can take care of it. And after they came to me and said, there's nothing else we can do, this person came back to me again. And I was, in a different state of mind. And she said, there are people waiting on organs. Would you be willing to make that decision at this point? And I was like, well, we've never talked about this. I don't know how many people sit down at their dinner table and talk about organ donation. I know we don't, especially African Americans. So I said, I just need to go back in the room and be with my son for a minute because I don't know what to do at this point. When I walked back in the room, all I could see was his heart beating through his chest. And I was like, this must be a sign that I need to make the right decision. I sat down beside him and I said, baby, I know if you could tell me what to do, you would say, save somebody, because that's just the kind of kid he was. He was always very respectful, very caring, very understanding of other people's feelings, how they felt about things. So I said, okay, I'm going to save somebody. I'm going to be a rainbow in somebody's cloud. So I donated his heart, kidney, liver, pancreas. And, there were several people that lives were improved because of his donation. And one life actually saved. His heart went to an 11-year-old boy who was in Boston's Children's Hospital about to die. He had a valve transplant procedure that went wrong. So they threw his heart up there and saved that kid. And I was actually able to meet him down the line. And I was that mom that could sit there and put my hands on his chest and my ear to his chest and actually feel my son's heart beating and hear my son's heart beating. And it's just been a remarkable experience. I've met with that nurse who came to me. She's actually on this call listening. Her and I are the best friends now. She's done something for me that I would have never been able to do. So she learned something. You don't approach too soon. I learned something that the people that are talking to you about wanting you to donate organs, they get a notification that this might be end of life for someone. So be there to see if you can talk to these families about donation. And, we've learned a lot from each other. And if I could just say one thing to anyone on this call is thinking about organ donation, please talk to your family about organ donation. Make it clear what they want to do, because you don't want to be in that situation that I was in, where I'm forced to make a decision about donation in the midst of tragedy. That was like the worst thing ever, but I learned a lot from it. It helped me through my grief process. And I can stand and talk about it now, knowing that, my son saved lives. And there was a doctor at Yale that used to always say in the end of his speeches, he would say, God is not looking for organs in heaven. When we get to the gate, he's not going to ask you if you got all your parts. He wants good souls. So don't take those organs to the grave. I appreciate you guys having me, and I hope that I've touched someone today that'll be willing to sign up to be an organ donor. Thank you.
Thank you, Ms. Fletcher, for that and sharing that story and for your courage and bravery over the years. Thank you very much. Next up, we'll bring Arnold AJ Johnson into the show. AJ, welcome.
Thank you for having me. It's obviously a pleasure and opportunity to have this opportunity to speak about the situation. I am presently waiting for a kidney. In November of 2016, I had a medical situation that forced me to go to the emergency room. And at that time, it was discovered that I did have chronic kidney disease. And over the next 6 years, under the care of a specialist, everything seemed absolutely fine, normal, no really issues. And then in October of 2022, not feeling the best at work one day, got up to go into the men's room, and as I was about to close the door, I lost my balance and fell out on the floor. And the assistant heard, and she came running in and called 911, get to the hospital. My numbers had changed. And at that time, it was known that something needed to be done to try and save the kidney. Over the next 2 to 3 months, they tried different medications. And one of the medications caused me to gain about 35 to 40 pounds of fluid in a matter of 2 weeks. And so about 3 days after Christmas of 2022, I woke up and could barely breathe and was quite nervous, really. To be honest, I thought that was it for me. Got to the hospital. They knew what was going on. So again, they started giving me medication to get that fluid off of me. And in a matter of 3 days, that 40 pounds of fluid had come off. And over the next 8 to 9 months, they were monitoring me and trying to see if there was anything that could reverse, but it became quite evident that I was going to have to start dialysis at some point. So in September of 2023, September the 12th, I had my first dialysis treatment. And since then, I have been going 3 days a week, Tuesday, Thursday, and Saturday, 4 hours every time. The first year was very traumatic, I guess you could say. Sick all the time. Didn't know how I was going to feel the day after. Over the last year and a half, haven't been as much, for most part, just get a little tired now. But the beginning, that first year, all the nausea and stuff that used to happen does not really happen that much anymore. But I am just actively on a list waiting. I am actually registered with Yale Hospital and Hartford Healthcare. And, it's an amazing thing to be an organ donor. Even before I was in need of an organ, I did sign up to be an organ donor because I was going to different functions.
This your boy right here.
I was going to different functions to support Mr. Brevard in the events that he was doing. And so I became very, knowledgeable about the situation of being an organ donor and immediately signed up, not knowing that one day I was going to be in need of that situation. So thank you for allowing me to tell my story. Normally, I'm a very private person, don't discuss certain things, but it's been said that, you never know who might want to be that help, that support. So that's why when I ask to, I tell the story. I do posting on social media, but thank you for allowing me to tell the story. Thank you to Men of Omega Psi Phi for this much needed conversation.
So AJ, and again, too, thank you for sharing that personal story. Because one of the things we talked about while we were doing the walkthrough is that, especially in the Black community, sometimes we hold our medical issues close to us, and sometimes we refuse to acknowledge things and until it's too late. So I'm glad you were able to get the help that you needed at the time, and pray that that comes through soon for you. So before we bring in Dr. Mason and Dr. Serrano, I just want to give the audience, first of all, opportunity to ask any questions through the chat or statements to our first, or actually, no, I'm sorry. We have to bring in, we have one more guest, Andrew Jones. So we'll bring in Mr. Jones.
Thank you, Kevin. Good evening, everybody. My name is Andrew Jones. I am also known as AJ, but for the panel, let's just call me Andrew to avoid confusion. I am a multicultural community outreach coordinator. I work very closely with Mark Brevard, and I have worked with Carolyn Fletcher out in the field when addressing the community. My role as a community outreach coordinator is to simply to educate the especially underserved communities where we've already mentioned that this conversation about organ donation and transplantation flies under the radar with a lot of families, and unfortunately, that conversation isn't had until something tragic happens. So we're trying to step in front of that tragedy. Not saying that it is completely avoidable, but we're trying to step in front of it and get people comfortable with the conversation, along with other difficult conversations that, like we said, are usually held close within the family. I'm also a heart transplant recipient. I was diagnosed with a cardiomyopathy during my college career. I'm the youngest of three brothers, and since we were all little, we were always active. We didn't inherit any congenital heart or any congenital medical issues. I mean, honestly, the worst I could say is that we inherited bad knees from my dad's side, but other than that, we were blessed with great health. Uh, Halfway through my college careers, when I began feeling the symptoms um, of that cardiomyopathy, shortness of breath, and I had graduated college, and I was admitted to the ER a few months after, and that's when I was told that I needed a heart transplant. I didn't understand the process. Like many people, I was in the dark about this conversation. I knew that organ donation was something that happened, and I was an organ donor on my license, but I never fully understood the reality of what it meant to be a donor, let alone someone who's now going to have to be waiting for heart transplant. I spent four months at Hartford Hospital in the cardiac ICU. At the end of that 4 months, despite the incredible talent of the nurses and the technology and the medicine that was available to me, my heart continued to decline. I was placed on an LVAD, or left ventricular assist device, which I lived by the grace of that machine for a year and 1 month. And at the year and 1 month, I did receive my transplant. Um, I think that the ability, I'm very honored to not just be on this panel, but to have a role where I'm able to share my story, because a part of my story, especially when I go and speak to younger kids in high school and colleges, I express the fact that I was doing everything that I could by the book. During my college career, I was eating healthy, I was training regularly, and making what I think what a college student would consider sacrifice, not partying and going out. And I still wound up with this heart disease. So I think a big part of what is usually taken from my story is that even when we do things right, we should always be prepared for the things um, that can go left. And so, although that I've had this heart transplant for just under 10 years, unfortunately, this my current heart has taken another decline, and I've recently been added back onto the transplant waiting list. Thankfully, my condition is very manageable, and I'm back now going through this journey. But I'm very glad that I'm still with the same medical team, the same people that I trust, who know me best, and being able to work with an organization like New England Donor Services, having their full support is really gives me no excuse to not to continue my work with alongside Mark Brevard. sharing and inspiring people and empowering people with this very important message. So I thank you for allowing me to be on this panel with a lot of distinguished, talented experts.
Thank you, Andrew. Again, thank you for your bravery and courage and sharing that story. So we're going to ask a couple of questions. So Andrew, we'll start with you. So how did receiving your first transplant, how did it just change your life, not only your quality of life, but spiritually and physically and mentally?
The first thing I would say is that I'm definitely not the same person I was before going into it. I will have to say that I was a little bit uh, I'll admit that I was a bit full of myself because I had this idea that, I wasn't invincible, but I was something close to it because I had never gotten so sick. I was weight training regularly. And when I was given that diagnosis, I still didn't believe that things would get even worse, but unfortunately they did. And so looking back, I like to say that through that arrogance and being so full of myself, I think that the universe definitely administered a very, very challenging test. And it wasn't just a test of health, but of my mental health and being able to instill my trust in complete strangers who are no longer strangers today. And I think that it's more than a coincidence that I end up working for the same organization that helped facilitate my transplant. I believe that I'm giving back, not just by meeting people where they are in the community, but by championing my coworkers, the people that work behind the scenes who don't get to show their faces, who are out on the road, who are in surgical units, and I'm beyond blessed to be in the position that I am, regardless of any challenges that have come my way.
Okay, thank you. All right, so we'll bring in Dr. Serrano just to talk to us a little bit about your role as a transplant surgeon.
Good evening, and thank you very much for the opportunity to speak to this community. I'm very grateful for that. I'm a transplant surgeon, and I work at Hartford Hospital in Hartford, Connecticut. As some of the stories that you've heard are some of the individuals and stories that I'm fortunate to take part of every single day. My role as a transplant surgeon is to evaluate individuals who may be in need of an organ, individuals who may want to donate an organ. So we have not talked a lot about living donation, but living donation is also a very incredible gift that someone can give while someone is still alive. So that usually pertains to kidneys and partial liver donations. So I evaluate patients who are in those needs. I also evaluate deceased donors, similar to Ms. Fletcher's son. And eventually I perform some of these operations. So I perform kidney transplants, liver transplants. I also perform organ donations, either living donors or deceased donors. So I'm very fortunate. I feel very fortunate that I can have an opportunity to change people's lives when people receive an organ transplant. It truly is transformative, not only for the recipient, but for the recipients, for the families of the recipients, for the donors, the donors' families, and also for the healthcare providers. For us, transplantation, and one of the reasons we went into it is because it truly is an opportunity to save someone. Anyone who is in need of an organ is someone who is dying without that organ function. And by us being able to provide that organ function back is basically bringing them whole and bringing them back to their lives, bringing them back to their families, their loved ones, and back to hopefully fulfill a promising career, a promising life, have children, have grandchildren. So all those things are very meaningful to me. So I'm very grateful that I am here today, and I'm happy to answer any questions that people may have about what I do. But certainly, as Mr. Brevard said earlier today, we hope to get some education across about some of the myths that you hear about organ transplantation or organ donation, which are very prevalent, yet, as I described, they're myths. So thank you all very much.
Okay, thank you. And so, Dr. Serrano, could you just we touched on it briefly, but could you just tell us the difference between the donations, right? So the living donations.
Absolutely.
So talk to us a little bit about that, please.
Absolutely. So in the United States, there are two types of donation. You can be a living donor. That means someone who is still alive, is very thoroughly evaluated, and they're determined to be not only healthy, but so healthy that they can live without a vital organ that they were born with. So the most common one is kidney. So we're all born with, or most people are born with two kidneys. And when someone has a brother, a child, or maybe someone who they don't know, they just met online, or maybe they saw a poster about their story and they wish to donate for them or on their behalf, they come to see us and they can receive a very thorough evaluation. I like to call it the Mayo Clinic $10,000 workup. That means they go through and not only they meet with multiple members of the team, but also they get blood work, urinalysis, abdominal imaging, social work evaluation. There's a slew of evaluations that occur to that individual. And once all of that is complete, we determine that they're fit enough to donate. And again, these are individuals that are not just your regular healthy people. These are super healthy people. I like to call them the triathletes of patients. So those are living donors. Deceased donors are individuals whose life basically ended too early. These are people who had either accidents or had the misfortune of having an event, a medical event that ended their life early. Deceased donors are generally divided into brain dead donors and what we call donors after circulatory death, or DCD. So brain dead donors are the people that, these are 75% of the donor pool in the United States. These are the individuals that, if anyone has watched a medical show, they're the individuals that they're talking about. These are individuals that may have been riding a motorcycle without a helmet, or maybe were driving without wearing a seatbelt and had a car accident. And these are individuals whose brains no longer work. So if we were to leave them alone, the brain wouldn't function and tell the heart to beat, and so on and so forth. These individuals, for all intents and purposes, are deceased. They have a death certificate, and at this point, the only purpose for keeping them on life support is for the purposes of organ donation. Either they've checked off that box in their driver's license, or their family has made the decision that they wish to have their organs donated. The other group is about 25% of the donor pool. That's the DCDs, or the donors after circulatory death. These are individuals that had some kind of a cardiovascular collapse. So they either had a heart attack or a stroke or a head bleed, and they didn't quite meet the criteria for brain death. These aren't individuals that are walking and talking. These are individuals that, for all intents and purposes, look exactly like a brain dead donor, but they don't meet the criteria for brain death, meaning that they still have some very primitive reflexes. Like if we lower the oxygen on their ventilator, they may cough because they're trying to breathe. But these are not individuals that are going to go on to have a meaningful life in the majority of cases. So these are the individuals that, if the family decides to keep them on life support, they will likely need a tracheostomy, feeding tube, and then will go on to leave the rest of their lives in a vegetative state. So in these cases, because of the medical prognosis, family decides that they wish to donate organs and withdraw ventilatory support or medical support. But this is a decision that's made by the family. And then at that point, or maybe the patient themselves may have made that decision through a living will. And then at that point, care is withdrawn in a very calm and comforting manner. No pain is expected to be experienced during this episode. And if the patient passes in a short period of time, they will go on to become organ donors. Obviously, if the patients maintain life for even a few hours, the organs would no longer be eligible for organ donation, because at that point, the organs have spent a lot of time in low oxygen state. So that's a very long answer to the short question that you asked me, and I apologize for that. But those are the technicalities of organ donation in the United States.
Well, no, thank you for sharing that because again, tonight is all about awareness and things of nature. And so, I was hanging on to every word, but you laid it out for those of us that are slow, so slow in processing and learning. So, thank you for that. And last certainly not least, Dr. Sherene Mason is an assistant professor of pediatrics, UConn School of Health, and she does some other things that she can share with you. But we wanted to bring her in as an important part of this conversation, especially she can talk a little bit about the pediatric side of organ donation and transplantation. So, Dr. Mason will bring you into the show.
Thank you for having me. Thank you, gentlemen, and thank you everyone for speaking. And I really appreciate Ms. Fletcher and Mr. Jones and Mr. Johnson for your bravery with your discussion that you have, because that's tremendously courageous, as Kevin had mentioned, Mr. Walton mentioned. So I'm Dr. Sherene Mason. I'm a pediatric kidney specialist at Connecticut Children's in Hartford. And I'm also the medical director for pediatric dialysis. So the first and only pediatric dialysis center in Connecticut is in Hartford, and I'm the medical director for that unit, and as well as the pediatric medical director for pediatric transplant, and work very closely with Dr. Serrano at Hartford Hospital. So our kids are transplanted with Dr. Serrano, and we take care of them pre and post-transplant in our ICU critical care unit. So that's the bulk of that work. But I'm speaking on behalf of, especially about children in general. So a lot of people don't realize kids also have kidney failure, even including babies. So we take care of kids who are newborn babies who have kidney failure, all the way up to young adults who have kidney failure as well. And the majority of our kids who have kidney failure have it as a result of congenital abnormalities. So they're born with one kidney that was not normal. They're born with a bladder outside their body. They're born with blockage to the kidney. Any type of malformation or abnormalities that impacts how their bladder works and how their kidney functions. And that's 50% of the cases of kids that we see with who need a kidney transplant at some point in their lives. A smaller portion goes along with having lupus or high blood pressure, but much less common as compared to the adult population where high blood pressure and diabetes are the two common cause for needing a kidney transplant. So, it always surprised me when a lot of people are very surprised that even babies need transplant or dialysis. And I work closely with Dr. Serrano, in terms of providing the care that those patients need. So my role really, as it comes to chronic kidney disease and end-stage renal disease, which means my patients are no longer having kidneys that function and they need to have either dialysis and or transplant at some point in their life, is really maintaining their health at a certain level to get them to that part of their journey, right? So managing their high blood pressure that comes along with kidney failure, managing their fluid overload. I know Mr. Johnson, I was going to say AJ, Mr. Johnson mentioned about being fluid overload. We have kids who they can't make urine, so they need dialysis to remove fluid, and we manage that as well so that they don't have any problems with heart disease or lung disease, and to optimize their care overall so that they can be viable kidney transplant recipients. And so that is always my goal, is to get them to that next level of care so they're not living on dialysis. Dialysis is really a short-term solution for a long-term problem. And so it's just really an intermediary to get the patients to a transplant when they're eligible for a transplant from a medical, psychosocial, and other reasons to get that transplant. And that's when we work very closely with Oscar to do so. Our patients, once they get transplanted, require long-term care, not only in the pediatric world, but as they get to be emerging young adults and adults, we transition to the adult nephrologist who takes care of their transplant, because this is a lifelong medical management. And so I think, if you had to ask me, what is one thing that most, even including providers I work with in the pediatric world who are not kidney specialists, don't realize, is that a kidney transplant will not last your entire lifetime. You will need more than one transplant. And so my goal when we have pediatric patients who are infants, who are 5, who have need for a transplant at some point, is as long as I can preserve their function as much as I can by managing all of their other conditions like high blood pressure, et cetera, I try to give their own native kidneys the longevity that they need as much as we can to get them to that level of where they'll need their first transplant, because we know they're likely to need a second and a third transplant to get them to be late adults as compared to adult patients who need a transplant. So thank you again for having us here, and I'm welcome to answering questions as well to explain some of this journey and to inform our members about this.
Right. Thank you. Thank you for that, Dr. Mason, and the work that you do with our young people and in this profession. So again, as Andrew instructed, he's Andrew for tonight. So this question is for AJ. So you shared your story, but can you share with us what it's like to live while waiting for a donor?
For the most part, life is normal. You deal with days where, and it's mostly the days after my dialysis. That morning after it, I'm usually a little more fatigued than normal. I tire easily. So as being an active person, I have to know when to sit down, when to, just tell myself to, AJ, it's time to sit down, which is hard for me because I'm always on the go. But, in the beginning, I went through the why me, why me, why me. But, I had to really realize and put my faith to action. A lot of people know that I travel with a community choir, and it was time for me to put that music, that gospel music that we sing, what we sing about, into action. And what we're singing to other people about is now it's time to speak that to myself. And one of the hardest things to ever do in life is to look yourself in the mirror and tell yourself the truth. And I had to really tell myself that I'm dealing with a medical situation, but it's not the end of the story. So and I'm not saying I don't have those days where you're just like, well, I wish I didn't have to deal with this, but it's just a bump in the road, and my outlook is very positive. I have relatives that have had transplants. I have 2 members of my choir that have had transplants, and they're all doing phenomenal. So seeing that is encouragement to me, to know that even when I'm having a bad day, every day won't be bad. And I just look forward to that phone call. I'm ready for it. I already have a bag packed to take to the hospital. I packed it the day I started dialysis because I'm going to be ready to go and just deal with it. It's not going to be an easy road, but it's a road I'm willing to take.
Thank you for that. And Andrew, so as a person who has had one transplant and now is waiting for another, what has community, faith, family, how have they helped you to keep going? What keeps you going?
Well, I will say that I'm very blessed to have the support systems that I do through my family, my close friends, and through work. With family, my family, well, family is family. They're not going to let you quit. There are moments even before I received my first transplant, my parents really had to get on me about making sure that I was showing up for appointments, because it got to a point where I was tired. I was in and out of doctor's offices being tested for different cancers and other diseases to nail down what was the cause of this issue, but I wanted a solution. And not being versed on really anything, how anything works in a hospital, my parents were the ones that drove me to trust the people who are taking care of me. My close friends, they really just kind of keep me grounded. And then through work, you work with people who know exactly what you're going through, and they've seen it all. And they remind you to they remind me that I'm human, and that expressing yourself is one of the most empowering ways that you're able to make it to the next step. It's too easy to hold in our feelings and our traumas. And when we address the community, that's what we're really trying to break past. We're trying to break down that wall to getting people to understand that just because you grew up a certain way, or it's maybe tradition in your family to behave a certain way, we're here to remind people that they are still human. So it's imperative that people practice instead of just listening. So when I go and do a presentation, I tell the audience that I don't want this just to be a lecture. I want this to be a discussion. I want you to be involved. I want you to see how organ donation sounds when it comes off of your lips. So that really is a big part of what we do. And well, it's a big part of what our goal is in the community. And besides that, I think empowerment through education is a big key to where we want to be, especially in the places that have lower donation rates. I'm sorry, lower registered donors. Um, so yes.
Thank you for that. Thank you. And I know Mark and Miss Fletcher have been patiently waiting, so thank you. So Mrs. Fletcher, again, I know this is incredibly different, and we appreciate you doing this. Just wanted to ask you, how did knowing your child help save lives shape your grief journey?
Well, when you're losing your only child, you don't know how your world is ever going to be right again. But knowing that through this process, you can get letters from the people who receive the organ to let you know how they're doing. So the 35-year-old woman that received this kidney wrote me and told me she wasn't able to have children prior to getting the kidney, and then she was able to have children. And then the 52-year-old man who got the other kidney and the pancreas wrote me and told me how grateful he was. And when I got that letter from that 11-year-old boy who insisted on meeting me and, wanting me to come to Boston to be a part of the program of the survivors of the ECMO machine, which is the life support machine that kept him alive until he got the organ, let me see that my tragedy was not in vain. People's lives were saved. Again, I was a rainbow for somebody's cloud. So that's what helped me get through the process.
And thank you for that. And so what would you want people on the donor registry to understand about donor families?
Well, you have to be receptive to the process. Like, you really have to have your head in the right space. Because when you're looking at your family member, regardless of which way the situation is going, is it an accident? Is it, are they brain dead, or do they have a heart attack? Or you have to look at that person and say, if it isn't written in stone what their wishes are, you have to look at them and say, knowing that person intimately like you do, what would they want you to do? That's why I really try to stress to people, please have conversations with your family about their wishes, because we don't do that enough. And then you're struggling with, what do I do it? Do I not do it? And then all those myths start clouding in your head and messing with you, and you don't know what to do. And it's a shame that so many people have died and not made the decision to donate and save other people's lives because they're not educated on what it really means.
And if I could, I just want to add one thing in regards to the donor families. At New England Donor Services, we have the aftercare department, and actually they monitor and support donor families throughout the process. And Carolyn actually has been with us for 15 years. So it's not a case where a family donates their loved one's organs and they don't hear from us, but we're there for spiritual, emotional support in whatever way they're needed. And that's why we try to get those families also active in activities. And like Carolyn is telling her story today, a lot of families say by doing that and advocating, that really helps them with their grief process.
Okay. Thank you. And Mark, thank you for jumping in, because we were going to segue to you and to Miss Fletcher's point. Why is donor registration still so low compared to the need?
I think, speaking on this panel also, and with different cultures, I think there are so many myths and misconceptions about organ and tissue donation. I think in the questions on the chat, there are a couple of questions about that. A couple of things our family history tells us, what stays in the house happens in the house, stays in the house. Do not talk about it to anyone. So we have a fear sometimes of sharing what our medical history is with other people. Then in our community also, historically, when you talk about the Tuskegee Airmen, you talk about the Henrietta Lacks, in those situations, there's a lot of mistrust in the health system among people of color. And I think they're very reluctant to become an organ donor. That's why it's so important that we have these conversations and we educate on organ and tissue donation. Like Ms. Fletcher said, she really didn't know anything about it when they approached her at the hospital. So I think it's best that we educate. So when you do come to that point, hey, I've heard about this conversation. I know something about it. So education is very important, and these types of forums are great to spread that information.
Yeah, and absolutely. And so my next question for you is how can organizations such as the Divine Nine help normalize these types of conversations?
So just like you're doing different panels, there's going to be a slide. My team, which Andrew Jones is part of, and actually I also see another one of my team members, Men and Crawl here, reach out to us so that we can come to different events. We handle all of New England. So we're all over the place in New England, and we're there to educate, whether it's at a church, a health fair. A lot of Divine Nine have health initiatives, links organizations. We're there to educate. Andrew is very, very instrumental in the schools, high school and elementary. Those students who are getting ready to get their driver's license and going to the DMV, and they may ask them, would you like to be a registered donor? So just by contacting us, we're all over the place, and we'll do whatever is needed that we can get the message out to the community.
Right, great. Thank you very much. So we're going to pause for a second, and I'm going to go to the chat. So I'm going to ask Brother Dixon to share any questions or comments we have in the chat.
Yes. Thank you, brother Walton. So there's two pertinent questions, but I'm going to stay in that same vein. So given some negative history between Black Americans and medical system, many of us harbor some distrust. How do we overcome this to become organ donors? For example, I've heard many Black folks say, I would never be an organ donor because they may let me die to get my organs. And two people in the chat kind of asked that same question in that same regard. So I don't know if Dr. Mason or Dr. Serrano want to start that off, and then we may go to one of the other panelists.
Yeah, and I can start off, and Oscar can add his information as well. As the person on the medical side, because I'm the one also taking care of very ill kids and young adults, right? We are separate in some respect to the New England Donor Services, right? When a patient comes in for medical care, we're doing everything to save that patient's life. That is my priority. My priority is not thinking about organ donation at that time. The priority is to do the best, do the right for the patient and families. And when the situation deems itself that patients are not doing well, and we've had that discussion, we've had patients that we take care of on life support for months before having discussion, for weeks before having discussion, when we've done all we could. And that's when at some point the New England Donor Services would come in, but they are really separate from my care that I provide directly to the patient. And so it doesn't deter or interact with the care that I need to provide in the meantime. So it's not as if patients are coming critically ill, especially for the young people I take care of, and we're calling New England Donor Services as soon as they hit the door. We're doing everything to provide life-sustaining therapy and care. And I think even Ms. Fletcher alluded to that when her son came in as well, right? They're doing all the right things to make sure that they give her son the best survival possibility and then make the decisions when we've done all we could at that point in time.
Yeah, I will second that. Because again, I was very confused about the roles of the people that had approached me versus the roles of the people who were taking care of him. After I figured out that distinction, that nurses and doctors were coming to me personally saying, this is the plan. We're going to do a medically induced coma. We're going to try to tap his brain to move some of the fluid out. They gave me distinctive roles of what they were going to do. And they kept me updated at every step in the road. So the person that came to me about the donation only those 2 times that they approached me. Other than that, my whole dealings were with the doctors and the nurses, and I had the most confidence that they were trying to save my child. It wasn't like, we need those organs for somebody else. I never got that impression.
Yes, I'd like to second that statement by Dr. Mason. I think it's critically important to understand that when we have an individual who comes in and has an event that has taken his or her life, the caretaking team of that individual is completely separate from the organ donation team and also from the organ recipient transplant team. So, for instance, when I go in as a donor surgeon, I play multiple roles, just like Dr. Mason. I have patients who I take care of. My responsibility as a provider for them is only to them. I have no other interest. I don't even have an interest in, for instance, if their wishes differ from their families. I follow their wishes. And so, when I go and do organ procurements, organ donations for New England Donor Services, which sometimes they require us to do, we are not even allowed in the room at times until a patient has passed and they've become a donor, just so that we don't influence the care that that individual receives. So it's very critical to understand that when you come into the hospital, you're ill, you're injured. Our number one job is to save your life. Donation doesn't even become a part of the conversation until the care has become futile. And at that point, it's separate individuals from the people that are taking care of you that are going to be talking about that. And your care providers will continue to take care of you just like you direct us. And it's not until then that either your family or you through Living Will has said, you know what, if it becomes to this point, and that's where that conversation that Ms. Fletcher has alluded to, as well as other individuals, have those conversations, because you may not want to live in a nursing home with a tracheostomy and a feeding tube. And if that's the case, then you have the option to donate your organs. I, in my own Living Will, have very clearly outlined parameters that I wish to not continue to be living in that condition, and my organs can be donated.
Thank you. Brother Dixon, more
Yes.
in the chat?
Yes, we have a lot. We have a couple more in the chat.
Right.
Thank you for that, Dr. Serrano. And to speak into that same vein, we have another question, and maybe talk about the legal component of this and everything encompassing it. So when I was in high school, a classmate passed away, and apparently he was listed as an organ donor. His mother tried to stop it because she didn't want the doctors to take his eyes. Does family have the right to block the deceased wishes or say don't take the eyes?
I could comment on this, and then also I see one of my other colleagues, Cheryl Edwards, and she would like to comment also. When you sign up to be an organ donor, it's a legal and binding document. So most of the times, an easy answer is no, it's legal. However, that's why we have a team of people at our organization, social workers and different persons who meet with the family and say, this is something that your loved one wanted. It's a way for their legacy to live on. You're honoring their last wishes. But to answer your question in the short form, it is a legal and binding document.
Okay, thank you, Mark. And you said someone else, your colleague?
Yeah, Cheryl, I didn't know if you wanted to comment.
Sure.
She could tell you, she works with New England Donor Services also, and she happens to be on the call.
You can actually also sign up when you sign up through registerme.org. You can say specifically, I don't want my eyes recovered. If you've made your wishes known in writing, that's helpful for us to know as well. I just wanted to comment on the earlier comments about the mistrust and that they won't take care of us. I've had the privilege of working with donor families now for 30 years with New England Donor Services. But prior to that, I was an ICU and an ER nurse. And I will tell you that when someone comes through the door, I don't look for your wallet. I look for your blood pressure. I want to check your heart rate. I want to see if you're oxygenating. And I want to give you the medications that I need to sustain you. And I will tell you, in the case of accidents, we're never going to see your license because the police will not give it up. It's like gold. They take it at the scene and we never see it. And that's not a question that we ask. Our goal is to make sure that we do everything we can to save your life. We don't know when somebody comes through the door, no matter how sick they are. Some people do okay, some people don't. We're not going to hedge our bets simply because we think you might be an organ donor. We want to save your life. That's what we're all in this for, right? That's what we all went into medicine and nursing for, is to save lives. The difference is that when, like Dr. Serrano said, when you are at the end of your life or care has become futile and that's not in keeping with your wishes, then we can offer the miracle that you were hoping for to somebody else, if that's what your wishes are.
And if I could just add here, that you heard me mention about the nurse who came to me. I wasn't very nice to her. And the nurse who came to me after, who convinced me to donate my son's organs, that was Cheryl. I met her some years later. She came to me after I did a presentation, and she said, "I'm that person." And I had to just hug her. We've been besties now forever.
Yeah.
Thank you, Shaw. Thank you. Thank you. That's like the nice connection right there.
Mhm.
Dr. Serrano stated that healthier people, similar to athletes, are greater living donors. On average, do Black people have a greater chance of having stronger organs than other races?
Unfortunately, no, that is a misconception. When I cut you open, the organs all look exactly the same for everybody. There is no difference that I have found. I don't think there's any evidence to demonstrate that any one race is superior to others.
Thank you.
If I may, Brother Dixon, we'll get back to you,
Go
right?
ahead, Brother
So,
Warren. No.
but we just want to say, so we know that there's some mistrust there, and do you all understand the reason why there would be some mistrust with the medical field?
Absolutely. When I go and speak to students, I find myself having to educate a lot of them on stories like the Immortal Life of Henrietta Lacks or the Tuskegee syphilis experiments. And it's because one, it's important for them to know that, and also because a lot of families they'll have these traditional values where they will tell their loved ones, no, don't even step foot into a hospital because you're not going to make it out, or you're not going to come out you're going to come out worse than when you went in. And that just becomes tradition, and a lot of people simply don't know why. So when we open up about these discussions, it does sound scary when we talk about what happened in Tuskegee and what happened to Henrietta Lacks. But I think that when they're able to step out of the dark and are able to learn something, they become empowered. They'll have an understanding of where that deep-rooted fear has come from.
And I want to add to that too. And I'm speaking from a standpoint of a cultural difference in terms of someone who may also be born in the Caribbean, right? And so, like for myself as a Jamaican, that there may also be, and I think Miss Fletcher hit on this, where you are born with your organs, you go back with your organs, right? And that sometimes is a barrier too in terms of donating, not just only from, especially if you come from a different country where you're not familiar with the Henrietta Lacks and Tuskegee story. It may be other things in terms of religious norms or cultural norms that are a barrier as well within our communities.
Thank you, Dr. Mason. I know there was something spectacular. You know what I mean? Us Jamaicans, we stand together. We stand together. General knowledge. So obviously health viability of the donor is the key element, but is there an age criteria for donors that may limit donation and that supersedes health?
Absolutely not. Age, I've actually studied it. I've published articles on it. Age, is just a number. A couple months ago, I operated on a 90-something-year-old gentleman. And we're going to see more and more of that as medicine gets better, as we get more educated and are healthier. It is not uncommon to have people into their 70s and sometimes even their 80s donate organs, because we may not put that organ into a 25-year-old. but we certainly would put it into a 70-year-old recipient who may need that kidney or that liver and the tissue that we talked about. If you are determined to be a donor, age is irrelevant.
And I just want to add, being in the community, I've registered a person who was 87 years old who wanted to make that decision to give the gift of life. And I'm not going to deprive anyone of having that opportunity if they want to give the gift of life to someone else.
Thank you. Can the panelists who are in need of organ donation give some information on the avenues that they have utilized to make it known to the broader population that they are in need of an organ donation?
Well, it starts as it won't maybe not as simple for some because access tends to be a very big issue in a lot of communities. But there are health fairs that are always popping up more than ever. And it really does, it can start with a blood pressure screening. That can be, it can be the start of a very long and difficult conversation, but a very necessary discussion. Um, in other words, it's calling your physician and going for your yearly physical, asking plenty of questions, and not just and not just being there as a patient, but being there as an advocate for your own health. So make sure if you lack a support system, to again reach out you can reach out to our organization to learn more. There are plenty of avenues that you can take to guide you in the right direction to getting a hold of your health. And that's something that I've learned to do a lot more, especially when living a life where I believe that I was doing everything correctly, and that even though I was, spending so much time in the weight room, these things can still happen. And thankfully, through all the athletic activity that I've had throughout my life, I became very familiar with my body. And my diagnosis started because I went out for a jog one day. I think it was in April, actually. I went out for a jog, and before even making it past my mailbox, I was experiencing what I didn't know at the time was shortness of breath. Before I made it into my house, I was on the phone with my physician. I saw him the next day. They put me on a mobile heart monitor, and I brought it to them the next day, and that's when they called me and they referred me to a cardiologist, and that's when I was diagnosed with that myocardiomyopathy, and that really is what kind of set off that whole journey. So don't wait until something bad happens. There's nothing, it can't hurt to just uh, to just go and have a little bit more screening or a checkup. So make sure you make your yearly physical, make sure you're seeing your dentist once or twice a year. Really simple things to start.
Okay. So, Ruel, Brother Dixon, are we done? Any more in the chat?
Yeah, we have a couple more in the chat, but you want me to keep going, or you want to?
Yeah, no, because we want to get to about some more myths. So, because we wanted to talk about the myths that happen. So, any of the panelists, just share some of the myths that you heard, and please debunk those myths for us.
I think one of the myths we already discussed is that if I'm in an accident and they see that I have the heart on my license, they will not save me. And I think both Dr. Mason and Dr. Serrano emphasize the importance of saving a life, and no one's even looking at that. Another top myth is that my religion does not support organ and tissue donation. All religions support organ and tissue donation. They look at it as an act of kindness, an act of gratitude, and an act of caring for your brother. And our organization also, when we work with the families, we are very respectful of whatever those traditions are with that particular religion. So that's also another myth. And I don't know if anyone else on the panel would like to discuss any other myths also, because there are a lot of them that are not true.
I think
we
would
want to get
maybe
all
put,
of.
yeah, I may include as well, because I mentioned this a little earlier with the kids that we take care of. So sometimes I've heard that I don't want to give my kidney because then I'll have one kidney and I was born with two. So why should I keep my two? Right. And so I always say we have kids who are born with one kidney or healthy. And incidentally, how we know they're going to be healthy is there's some people who are much older who incidentally had to have any imaging done for their belly and was recognized to have one kidney all their life and never knew it and lived healthy lives. So we know as long as you take good care of that one kidney you were born with, you can live a healthy life as well. So we were just blessed with having two so that we can be a blessing to someone else.
Another one also is that the rich and famous, they receive kidneys before others. There is a national waiting list, and that is not true. It's how sick you are that you're moved up to the top of the list.
And can I add a little more to that list about for pediatrics? So, and I know Oscar can add to this as well. For pediatrics, the patients who are under 18, if you're on, and we're talking about the deceased donor list, not there's no living donor list. There's just a living recruitment process for donation. But for the deceased donor list, children gets priority if you're listed before 18. So, and you'll be surprised how many people don't know that they have children in their own families that I may be taking care of who need a kidney transplant at this point. So keep that in mind when we think about the stories that we heard, the stories that AJ Johnson mentioned as well. He's looking ideally for a living donor. That's a kidney that would last longer than a deceased donor. So even making the decision to donate can happen now while you're alive. It doesn't have to wait and just have it on a donor card. So just always wanted to make sure that people also think about that option.
I also wanted to add and kind of build off of previous topic about uh, being at the hospital and if you're seen as a donor, little will be done to save your life. Also on the recipient side, or really just in general, again, people are afraid to step foot into a hospital. I think I would want to learn more about, or actually to hear from Dr. Mason or Dr. Serrano, what are some of the things that have, what are some of the things that have been implemented in the recent years to rebuild that trust with communities affected by those medical injustices, such as the legacy of the Tuskegee syphilis study, and how is there a way that we're able to evaluate whether those efforts are improving willingness for communities to consider organ donation?
I could take that question. So, this is something I often talk about. As some of you may know, up until 4 years ago in 2022, um, the United Network of Organ Sharing, which is basically the big parent federally funded organization that funds transplantation and organ donation, used to utilize the an equation for calculating your kidney function differently based on race. And so this has been on national news, on TV. There's just been a lot of publicity around it. So if you were African American, the equation would give you a higher kidney function than if you were non-African American. So in the equation, it said African American versus not. So therefore, patients up until that point who were of African American background would be artificially demonstrated to have a better kidney function than they actually had. So if you compared it to a Caucasian person, a Hispanic person, their kidney function would be lower for the same value that you measure just from the urine. As a result of this and this disparity and this what we call systemic racism, there was a very large group of individuals, medical professionals, that advocated for that to be removed from the inclusion. And in 2022, we were actually able to get that done. I was part of that group that got it done, and we were very happy and proud that we were able to do that because, as I've said already, human beings are human beings regardless of race. I have not seen in my decades of being a physician any difference in medical physiology according to race. So, as a result of that, if you are of African American descent, and you were noted to have kidney dysfunction, you need to go back to the earliest point where your kidney was first noticed to be diseased. And we need to go back and recalculate those functions so that you're able to receive more time on the wait list. Because right now, if you go in and you get diagnosed with end-stage renal failure or chronic kidney disease, if I put you on the list, unless that number hits a critical number, you don't start accruing time. But as you can imagine, if you were already starting at a higher number based on the calculation, then you would have artificially lost out on time. So that's one of the ways that we have in the community, in the transplant community, have instituted in order to make up for that inequity that we basically caused as a result of these equations being used in the past. And these are equations that date back 50, 70 years. And Dr. Mason can speak more to why they came about, and they measured differently for different races. But that's one way that we were able to get that done.
So that information that you shared about being able to go back and get back on the list at a different point, is that information that's widely known through the transplant world?
Absolutely. Yes.
Okay.
So if you
All right.
if you come to our center and you are African American, that gets checked off in the application, then we'll do everything in our power to go back and try to find an earlier date when it's called an EGFR, or estimated glomerular filtration rate, will have been if there's a point in time earlier when we could have gotten a lower number so that we could start the counting sooner.
Okay. Thank you. Thank you for that. That's very helpful. Good information to know. So it's 7:17, so we're going to begin to land this plane. So we're going to give each of you opportunity to speak, and I want to start with Brother AJ. So if you could speak directly to someone hesitant about becoming an organ donor, what would you say to them, and what do you want to understand about someone who's waiting for a transplant?
I guess to understand that it is a gift of life. Again, I have family members who have received transplants, and they have developed a whole new family with the person who transplanted to them. And they are the person who made the donations are living healthy to them. It's probably one of the most selfless things you could probably do. And even I've had people who I know who have made phone calls to try and see if they would be a match. And although they were not a match, just the fact that they took the opportunity or was willing to make that sacrifice leaves me a little speechless. When I first found out about someone who I know tried to call, I was speechless. To me, the word thank you just seems very not enough. But if anyone wants to call or see if they're a match or anything, it's greatly appreciated. And I know, and maybe Dr. Serrano can speak about this because I don't know a lot to say much about it. There is like a swap program, like you may not be a match for me, but you might be a match for someone else that would benefit me later on. I do go for evaluations every year with Hartford Healthcare and Yale. And so far, my numbers are great. So I'm in a great position for receiving a transplant.
Okay. Thank you for that. AJ, 2 questions. One is, are you still singing? And the other one is, what gives you hope right now?
Yes, we're still singing, working on a new album as we speak. And my hope is my faith in God. There's much more for me to do in life. And I'm not letting this sidetrack me. I still do whatever I can do. I do know when my body tells me to sit down, but this is not going to stop me. And I'm just going to keep going. And when I get the transplant, I'm going to keep going after that too. So my faith and my hope and my trust in God is on a whole nother level.
Thank you for that. Thank you for being here. Mrs. Fletcher, you shared your story and you shared also how your son lives on in the people who received his organs. So what does legacy mean when it comes to organ donation?
Great question. So again, like I said, it's important just to have the conversation with your family so that they know what your wishes are. And since his passing, I've had the opportunity to be involved with some awesome things. Like he was honored in the Rose Bowl parade, in Pasadena, California. If I could, I don't know if you would be able to see this or not. You won't be able to see it. But if you're familiar with the Dixwell Avenue area in Hamden, there's a mural on the side of the gas station there, right at the northbound entrance to the Merritt Parkway. There's a huge mural out there on the side of that gas station. My son is on that wall. So they've afforded me so many opportunities to honor his legacy through the different things that we've done with the mural, with him going to the being in the Rose Bowl parade, and I'm about to go to the Transplant games in Denver, Colorado in June, which all the athletes in the Transplant games have received organs, their transplantation. So it's just been a huge opportunity to keep his legacy alive through all of these different things that I've been afforded through New England Donor Services and Donate Life Connecticut. And it's through Mark. Me and Mark have been traveling this road for a good little while, spreading the word.
Well, thank you. Thank you very much for sharing your story and being here this evening. And your strength and courage is incredible. So thank you again. Andrew, so as a recipient and then someone who's waiting for another transplant, what gives you hope right now?
Well, that shouldn't be a hard question, but for some reason it is. But I think what gives me hope is really just seeing people open up a little bit more about the conversation, which is why I consider myself so lucky and just beyond blessed to be in a position to get people to open up about this conversation. Now, I'm not saying that I'm going to schools and, begging people to be an organ donor so I can get your heart, but I'm very happy to see that people, just like Carolyn mentioned, how important it is to keep having this conversation, because there's so much fear behind the the topic of end of life. Everybody wants to focus on the now and what they want to achieve, in the next 5 or 10 years, but not enough people think about, well, what if, 5 or 10 years doesn't come? What if tomorrow is my last day? And I think that just by continuing to present and have the conversation, I continue to empower myself. Every time I give a conversation, or host a panel like this one or do a presentation, I can run off that energy alone for the next week or two. So it really does make a difference when we keep having these conversations. And I'm just so thankful that I get to be in a position where I have to keep having these conversations. It is literally a part of my job. So because it's part of my job, I want to emphasize to as many people as possible how important it is to keep having these conversations.
Thank you for that, Andrew. And not lost on us, this audience is just kind of your resolve, your calm and your strength. So thank you for being here and good luck on your journey as well, brother. So Dr. Serrano, you've heard a couple of, what is one thing every person watching tonight can do to help save lives, starting now?
Yeah, thank you. I think the most important thing is have that conversation with your family about organ donation. Have those wishes in your mind as to how you envision should something unforeseen occur. What would you like to happen? and communicate that with your family members. And the second thing is, if you're not already an organ donor and you are interested in being an organ donor, I believe Mark Brevard is going to provide you with some information, some links about where you can go and actually register if that's what you wish to do. If you don't wish to do that, that's totally fine. But at least educate yourself on the possibility of being able to donate your organs and live on. For many of the donors that I see, I take care of, and for certainly 100% of the recipients that I take care of, a transplant organ means living on for the donor that gives up that organ and living on for that individual that receives that organ. So it's certainly an incredible gift and something that for us in the medical community is nothing short of a miracle. Thank you.
Thank you for being here, and thank you for your work. It's incredibly important. And Dr. Mason, what gives you hope right now?
What gives me hope is this conversation and bringing communities together. What gives me hope is working with kids, and that's why it warms my heart when I hear the story with Mrs. Fletcher shared, because I work with kids and young people that I can see the impact on their lives. What gives me hope is information and being informed. So, for example, I put in the chat for everyone to know their numbers, right? So to advocate for your own health in terms of knowing how do I have conversations to identify if I'm at risk for having kidney failure. There's a GFR calculator that's on the internet I put a link to so that you can know your numbers as it relates to your kidney health to then bring to your doctor's office to have the conversation. So the goal is if you have kidney disease, that if you need a referral for transplant, that you referred early. That early and timely referral is important. So that gives me hope that there's new conversation going on. There is elimination of that race-based formula and removal of that because we don't use that in pediatrics. It was only the adults. And so that gives me hope that there is a growth mindset that is willing to engage in a new conversation to give people hope and life.
And thank you, and Dr. Mason, thank you for your work with our babies and being here this evening. Very informative. And we're gonna last and certainly not least is Brother Mark. And Brother Mark, we talked about doing a call for action. So you can get an opportunity to answer the question and gives you hope as well. But also just talk to us about how we can get on the registry and what needs to be done to kind of get folks to really consider being a donor.
Yes, everyone stated my hope is the same as the others. Education is very important, but I think it's so important that you know how you can register to become a donor. You can registerme.org. If you have an iPhone, you can register actually on your health app. Sorry for all you Android users, but on your iPhone, there is a health app that you can register right there, and also at the DMV. Also, you have here my email and Andrew's email. Our team goes out into the community, and I really want to thank you, brothers, for putting this together because it's this type of conversation with different organizations that helps our community to know and be educated on organ and tissue donation. So if anyone else is on this call with another organization, whether it's church, school, another Divine Nine, let them know that, there are people out there that can come and have this conversation also. And we travel all throughout New England. So wherever we need to be, we will be there. But it's very important to register if this is something you want to do. And it only takes literally 2 minutes to go through the application and the health app. And by doing that, you're making a difference in saving lives and helping someone have a better life because of your registering to be an organ donation. Registering to be an organ donor.
Well, Mark, thank you for those words and showing us, but I think you upset some Android users, but they'll be all right.
That's it. Well, they can call me. They can contact me.
All right. Well, listen, thank you. Listen, this has been so powerful. And not only are you great panelists, but you came in on time and under budget. So we appreciate that as well. As we bring this powerful conversation to a close, I want to first thank our panelists for their honesty, courage, sharing their story, their willingness to share their stories that are so deeply personal. Your voices remind us that organ donation is not just a decision, it's a legacy. Tonight we heard about the joy of a second chance, the what it's like to wait, the strength to say yes in the midst of a loss, and medical realities that shape these outcomes. If there's one thing we can take from tonight is this: organ donation saves lives, but conversations save time. Registering as a donor is important. Talk to your family and your family about your wishes is just as critical. We encourage everyone watching to take the next step. Register as an organ donor, share your decision with your loved ones, encourage someone else to do the same. So I thank you for allowing me to moderate this panel. I am humbled. And with that, I will turn this back over to our chair, Brother Giggy Martindale.
Good evening, everybody. And I want to say thank you to the folks that attended this event. It seems like everybody learned a lot. I know I learned a lot today. I want to thank Dr. Mason for bringing us this idea. We finally got it going, so appreciate that. I want to thank the panelists. And, everybody be on the lookout for the next event. It'll be coming. And we'd like to see you join that one. So everyone have a good night and sign up, become an organ donor. Brothers of the EII, if you could just stay on. Appreciate it.
Brother Martindale, I'd like to give the last word to Brother DR, Brother Bailey.
Oh, sure. My fault.
Brother, this was outstanding. This was. And, nothing is stronger than when God drops you a hint. I had just told my wife about a month ago, I said, next year when we do district conference, I'm going to reach out to the Kidney Foundation and try to work with Donate Life. And then you brothers came with this. I spent 6 years on that board, Kidney Foundation of New England. I have had 2 kidney transplants. So I know what goes into this and what the impact is and how it can change a life. That second transplant allowed me to see my children grow, and my wife and I have a very long marriage. So it's just a benefit and a blessing, and you are all doing God's work. To the 2 people who are waiting for the transplants, I have been where you're at. I waited 8 months the first time, and I waited 5 years the second time. Stay strong. Wrap yourself around God's hands, and most of all, have a good supporting cast around you, your family and all of that. That's what kept me going, and you'll be fine, and we're going to keep praying for you. Brothers, wonderful event. God bless.
Thank you, Brother DR. And I'd like to acknowledge our first Vice DR, Brother Anthony Lilly. I don't know if you have any words that you want to share, Brother First Vice.
Good evening, everyone. Thank you, Brother Bosses Dixon. Great program. I, too, have a cousin who was a recipient of a kidney. Again, great program. Thank you for inviting me, and thank you for having me on. Looking forward for future programming. And I yield back to you, Brother Dixon.
Thank you. And on behalf of Epsilon Iota, I just want to thank everyone for being here. Most importantly, thank our panelists for being vulnerable and sharing a lot of information and informing the community. And with that, I would like to say good night, everybody, and thank you for a great program.
Good night, everyone.
Good night, everyone.
Home safely.
Good night, everyone.